everyone. We've had a bit of a change in musical chairs, as you'll see. So we're doing some things a bit differently today. We're starting off about the exit from lockdowns framework document that we have published today, and then that would be with Nikki and myself, and then Gavin will be saying a few words, followed by Paul and Rory. So without further ado, I think we'll start by focusing on the exit from lockdown strategy. This is going to be a bit like pre-pandemic days when Nikki and I used to have a double act when we used to go out talking about joint needs assessments and what have you. So we're going to be doing a bit of a double act to go through what this document is about and how we see ourselves easing out of lockdown over the coming weeks. I'm going to just give a few details at the beginning, covering off the context of why we're doing this. Nikki will look at the evidence and what that has been informing the approach we've taken. We're then going to talk through the different phases together so people can get an idea of what they mean and the timings, and then I'll give a few closing comments before handing over to Gavin. So, without further ado, if we can go into the exit from lockdown and the next slide, please. So, there are 4 aims to the framework. The first, obviously, is mitigating and minimising the impact of COVID-19, but also looking at protecting and preserving life generally, minimising economic, social, environmental impact, and promoting restoration to normality as soon as possible. So basically what we're looking at is considering getting business, social, cultural, recreational activity up and running alongside the need to protect the island from COVID-19 and setting out how we do that through a series of transitional measures. It's really important to emphasise here that we're taking that local perspective, taking into account our specific needs. So yes, we have been looking at what's going on in the rest of the world, seeing what's worked, what people are considering, but this is very much focused on our community, what will work for us. And also, people need to understand here, this is an iterative document. It will change over time. It will change as we have new evidence, and circumstances change, and we'll also be adding to it because within the document at the moment it doesn't go through how schools will go back. That is a very difficult area to look at. A lot of planning is needed over this, and that will be slotted in as we go through and we work up the document more and more. And also in relation to the health services and how we bring things back to normal, how we introduce back elective surgery and other parts of the service which have been put on hold over this particular moment in time. However, what we've produced is what we know now. It's based on the evidence that we have now. And I think, as we've said all along, we have taken a very cautious and conservative approach. So please bear that in mind when you see what we're proposing, and particularly the timings. Some of the timings, for some people, they might think that's too long. But that's because we are taking a cautious approach, and we'll explain more later about how that might change over time, that the timings that we're giving might not be what we finally get. So that's my background, and I will now hand over to Nikki.
So first of all, before we go into our decision making, just to give you our daily update. So we remain on 252 positive cases. So we've now had no new positives. This is our 5th consecutive day of no new positives. So really encouraging from that perspective. We are down to 16 active cases. So again, down from in the 20s down to 16, really encouraging as well. And we now have a total of 222 people who've recovered. The number of deaths remains on 13. So very encouraging that everything seems to be progressing in the right direction. What I'm going to show you now is a summary, and I know some of you will be familiar with this graph, but a summary of the graph that we present with regard to our overall COVID activity. So if you look at the graph, the top line, the maroon line, is our total our total number of cases. And as you can see, that was initially on a trajectory up and now has plateaued off nicely. So also going up are cumulative recoveries. And you can see how the total case and cumulative recoveries, the oranges are cumulative recoveries, those two lines are now coming together. Decreasing, going downwards, is our active cases. That's the green line. Again, really encouraging how you can see our active cases have come down completely. So the picture that we're seeing with a stabilization, no further deaths, a decrease in the number of active cases, an increase in the recovered cases, and a stabilization of our total number of cases is a really positive picture as we face our easing of lockdown. So what we wanted to pause today is discuss with you and outline is what has informed our decision making. Now, I've spoken to you for some time about our attributable cases. Now, attributable cases have been really important to us because knowing where the infection comes from enables us to put the appropriate strategy in place to control that infection. So if you looked in early days, travel was by far our most important sector where we got our infections from. So most of the infections were imported. As we brought in our travel restrictions and so on, that group dramatically declined and now only accounts for 19% of our total. We've spoken about the care home, both residents and care home workers, and that accounts for about 40% of our total number of cases. We are in a much better place with regard to the care homes, and things are improving there literally day by day. So that's really encouraging. Our most important slice of the pie, so to speak, now are the contacts of known cases. Now that's really positive because these are people that we've identified as being at risk, we've put them into quarantine, and we test them when they become symptomatic. So these are people that we're watching really carefully. So identifying most of our cases through contacts of a known case is a positive sign. Now the group that I watch most carefully are the cases of unexplained community seeding. Those are the groups that worry me most because these are cases that just pop up in the community that we haven't got any explanation as to where they came from. And that now accounts for 12% of cases. And the last case of definite community seeding we had was on the 21st of this month, with a possible case occurring about 10 days later. So we're not sure about the case 10 days later. We think it might be linked to another issue that we're dealing with, but the last definite case was on the 21st of April. So really, really positive from that perspective. So if we then also look at the next graph, which is our modelling graph, and with our modelling graph, there are two dotted lines that I'd like you to focus on. The first is the grey dotted line, and the second is the amber dotted line. Now, if you look at the cases, we detected our first case on the 9th of March, and the grey line follows the initial cases that occurred after that and showed what would have happened if we'd done absolutely nothing. So that's what would have happened to the number of cases. So you can see an exponential increase in the number of cases. If you move along to the amber dotted line, what you see there is what happens when you bring in some social distancing measures. So that includes the social distancing 2 meters apart within the community, some school closures, but not a full lockdown. So if you move along on that graph and you look at the 21st, you can see the trajectory that we were following with normal social distancing measures on the 25th. Now, after we went into lockdown, the incubation period of the virus is about 5 to 7 days. So if you move along 5 to 7 days, what you see is that blue line flattening down. Now, the blue and green lines might seem confusing. The green lines are individual cases. The blue lines are our 5-day moving model. So what we do is we amalgamate 5 days of cases together because they're small numbers, and that flattens out the curve and enables us to see trends. So what you see from our 5-day moving model, which is the blue line, you see that dramatic flattening and squashing of the curve. So that shows us what happens if we'd done nothing with the grey line, just brought in some social distancing measures, the amber dotted line, but then shows the effect and the impact that lockdown has had on the prevalence of the virus within our community. So the other thing that informed our decision making was our contact tracing process. And I don't think it's any secret to you what a fan I am of test, contact trace and quarantine. I think I must have said this to you hundreds of times. But if you look at when lockdown happened, and it's marked on the graph, is prior to lockdown, the average number of contacts per case was in the region of 20 contacts per case. And what you see moving 5-7 days on from lockdown happening, so again allowing for that incubation period of the virus, you see a dramatic decrease in the number of contacts per case. So down to round about 5 contacts per case now, obviously some variation there. So again, that's hugely important, because if one person has 20-30 contacts, the chance of them transmitting the virus is so much greater. Whereas if they have 5 or less contacts, again, you're cutting off those transmission events. So really, really important. So when we were exiting lockdown safely, there were things that we thought we really had to consider carefully. The one is that we didn't want to lose the gains that we had achieved. These are hard-fought gains. The community's worked with us, but there has been a considerable sacrifice that the community has made to achieve these gains. So that's really important. The other thing I want to be quite open and transparent about from the start is no exit from lockdown is risk-free. There's always going to be a risk as we progress, but what we're looking at is risk reduction. And so we're not looking at risk elimination, but we're looking at quite a dramatic risk reduction if we bring it in a phased way. The backbone of our public health response is our test, trace and quarantine, but Deputy Salisbury and Deputy St Pierre are going to talk about a bit later, is the enhanced bailiwick testing programme, which we're also hoping to bring online, which is an extremely exciting, very ambitious programme. So I'm going to now I think this is me still. So the exit plan has been planned over 6 phases. Now, it is a conservative approach, and what we've said is we've put in numbers between the phases, but these are not tablets of stone. We haven't said that this is a strategy and this is what we're going to do, this is our roadmap. What we've said is this is a framework, and as evidence comes to play, we might in fact shorten some of those times. But what we wanted to do is put something out that we thought could realistically be achieved, and actually we could probably do better than that. So it's really, again, setting out a basic framework for us to progress. Now, what we've done is we've tried to have adaptive triggers, so release triggers where we go forward, and adaptive triggers, which means that we progress backwards. And those will then inform how we move forwards and how we move backwards. And we thought, again, these are not perfect, and we've spent hours looking globally at what's been done, looking at what other people are doing, looking at whether we should model it in an R value, whether we should be looking at incubation periods of the virus, exactly what we should be looking at. And we came up with indicators that we felt were relevant for us. So I think you recall that when we went into lockdown, one of the things was that we had a case of unexplained community transmission. And when you look at the history of what was going to happen with an unexplained community transmission, we were on a trajectory upwards then. So what we're looking to see is either stable or decreasing cases of unexplained community transmission, so an unexplained community source. And as I said, we really are optimistic that we're starting to see a dramatic decrease of those. Stable or decreasing hospital admissions. I think I've spoken to you all before about sense checking all of our figures. So if we've got very little in the community, is that translated to a similar low level of activity in the hospital? So again, looking at what's going on within our hospital. No new clusters in the community that pose a risk for ongoing transmission. So if I get a cluster of 2 or 3 people, I know exactly where it came from, and yes, 3 people are infected, but I'm happy that that's contained. I'm less worried about a cluster that I can't explain, that's spreading all over the place, that we're not sure what's happening with. So it's where we think there's that risk of ongoing community transmission. And finally, if we think that there is no public compliance and everyone is just mixing as they want to, we're seeing increasing numbers of the virus, that would be another reason for us to go backwards. From our point of view, we don't think the latter thing that I've discussed is going to be an issue because we've had such great compliance. So that was trying to put some evidence as to why what we'd use to go forwards and what we'd use to go backwards. And we've tried to then put numbers on that for each stage. But you'll have to forgive us if we change our mind with regard to the numbers, because if new evidence occurs, we of course will review what we do. And I do think it is you now, Heidi.
Thanks, Nikki. As you'll have seen from the earlier slide, we've got 6 phases. We're in phase 2. We've started these off from lockdown. We know that we've got limited businesses out there working with following social distancing guidelines and hygiene rules. We've talked about the household bubbles being extended and the expansion of how exercise can be undertaken. And we're saying, and as Nikki has given the caveats there, 4 weeks. So we're a week and a half into that. So in theory, we could, in 2.5 weeks, might even be sooner, move on to phase 3. So, phase 3. Thank you. So phase 3 is the start of, hopefully, takeaways again. Yes, this wasn't me that made that happen, but we will be able to have takeaways again. Businesses that are currently operating might be able to work more back to normal than they are at the moment. We're looking at having libraries, museums opening, places of worship opening, but not for congregations, more for private prayer, and hopefully the expansion of who can attend funerals and how funerals can be undertaken. Nikki, do you want to do the social bit?
Yeah, so during that time, we're also looking at expanding our social bubble. So adding more households to the bubble, and we can work out how many more households you can add to the bubble at that stage. So again, instead of opening everything up, we're saying, well, maybe another couple of households can come into your bubble, and your bubble becomes a bigger household bubble. And that just starts increasing social connectivity. One of the things that has impressed me during this time is how important we value social connectivity as part of our island life. And I think that's really important. And so, again, it's trying to design an exit strategy that takes into account what's important for islanders and not is just, well, let's do this and this, but actually see what people want. And I think with the duration again, what we've said is that it can go backwards and forwards. So we've said the duration is 8 weeks, but actually if we do very well in this phase, we could actually count back those 8 weeks. If we have no community transmission, we can then use those weeks to count forward into that stage. So again, it will then concertina the time between the 2 stages. And I think that's really important that we're flexible with regard to that.
Thanks, Nikki. So yeah, that's in 2.5 weeks' time. I know we've heard various comments about the extended bubble. There was a lot of people living on their own and with grandparents, single set of grandparents being able to see their grandchildren. We do understand issues over having 2 sets of grandchildren on island and having to choose. But this is for a short period of time, and we're doing this in a controlled way so we can manage that risk, as Nikki mentioned. So, phase 4, well, this is a big change. This is where we get retail, hospitality, beauticians, hairdressers, starting to operate under strict guidance and real social distancing rules where applicable. Gyms, pools and restaurants. So we'll be think about restaurants might have to spread out tables more in terms of how they can operate. But that we will be seeing so many more business being able to operate now. And Nikki, on the social side?
Again, it's that social connectivity, expanding our household bubbles even further, so perhaps 5 or more bubbles at this stage. So again, each time the number of people that you're including in your bubble is increasing, and that'll hopefully help as we come up to holiday times and when people are wanting to socialise more with the lovely weather. So I think that's really important. The duration of the time, at this stage, because the difference between 4 and 5 weeks, we've put a fixed 8 weeks, but should our measures exceed what we think, then we may well revise that down. So it'll all depend on what happens over that period of time, and particularly with our expanding testing programs. So that may provide us with some very useful information. Thank
you. And then we get to phase 5, which basically is the Bailiwick bubble. So as far as possible, it'll be business back to normal. There will still be social distancing rules, but basically this is where we can operate as normally as we can and having regard to the virus in the community. Now, at this point in time, the travel advice won't have changed. It will still be travel that is essential and expectation of there being 2 weeks isolation. But that is where we are now. these things might change. We might have evidence that it's not necessary to have 2 weeks isolation, but also if things are more favourable amongst our neighbouring jurisdictions, then we might be able to do things differently. We might be able to ease that off or change how we do that in considering isolation, whether it's necessary, and who we might want to expand into the bubble. And so that will lead us, that's for 4 weeks, we're saying now, but again, as Nikki has said, if we get our enhanced testing in place and the evidence is good, it could be sooner than that. And that then leads us to phase 6, when we can't say when that will be. It might be when we have a vaccine. It might not be. It might be, as we were saying, I just said, it might be because our neighbours are doing a great job as well. And we can say, right, we haven't got those risks. We can afford now to open up. And I don't know if, Nikki, you've got anything else to add on that?
No, other than it'll be the risk profile of our neighbours. So obviously we'd like to get a vaccine as soon as we can, and we are engaging with the UK with regard to that. So I think that's really important. But if the risk profile goes down in the surrounding areas, we may well relook at that. So it's all about what the risk is to the bailiwick and balancing the risk of that with the other risks of isolation. So I think that's the most important.
Thanks, Nikki. So that is basically the overview of the exit from lockdown framework. As I said, we've mentioned this quite a lot, and I'll say it again. If we expand our testing, which is what we're planning to do, and Gavin will say more about that in a minute, to say covering care homes, health and care workers, schools, colleges, we may be able to really concertina that right down. And that is one of the strategies that we've got in making things work faster. So, but this is where we are now. I can't emphasise more. This is from all the evidence that we have now, and we are where we'd say, is it perfect? No. Do we have all the answers? No. But lockdown was simple. I mean, that was just a case of doing one thing overnight. That was simple, and I think there was a good analogy made the other day about how lockdown was like the hammer, where we squashed the infection, squashed that spread of infection, so our medical services could cope, and so we weren't overrun. And the analogy was that the easing from lockdown is like a dance, and how we have to learn that dance and have to learn how we live with the virus within our community. And we are saying that, we might not get the steps right immediately. We might have to stop again and go back a bit and just learn as we're going along. So it is much harder than lockdown, but also it's important to say it is a dance with two partners. So what we've done today is highlight our exit framework, but there's also a recovery plan that goes alongside that. And I think it's important to realise we both are needed for the future. And both of those will go to the states, and our political representatives will be allowed to debate them in due course. So I think understanding this isn't a document that sits alone, and it's something for the whole states to work around. But finally, I would like to say how we really would welcome feedback from the community for this. We know we haven't got all the answers. We haven't a blueprint to follow. We have a blank sheet of paper. There's very little evidence to work from about what the rest of the world's doing. The rest of the world is in the same position as us. We are easing from lockdown earlier than many other jurisdictions too. So we've got very little to follow on. So we're saying we haven't got the answers. We do welcome feedback, as always. We're getting some really excellent ideas, people trying to help and support us. And that's been very much at the heart of what we've been doing over these last few weeks. The whole Guernsey Together thing has worked really well. This is a living document. So as much as we have put this together today, and this is a document that is led by the Committee for Health and Social Care, this is a community document. It's a living document which will change over time and needs to change over time with the evidence and the work that Nikki does and the expanded testing we do. So we really do welcome the whole community coming, giving us their ideas and helping us on that journey out of lockdown. So that's the first part of the conference today, and I'm going to move on to Gavin.